Today we go to the topic of intra-aortic balloon pump. I am Mr. Hari Pradeep, lecturer from Sri Sanmuga Institute of Aortic Science. Okay. And now, last classes we have go through what is cardiac arrest and also myocardial infarction, as well as what is cardiac output determination, how we can be able to assess cardiac output determination by using several methods. We have to go through that all things. And now, intra-aortic balloon pump. Have you heard any intra-aortic balloon pump? Devices that in the hospital sector. What you have to know is you have to know the intra-aortic balloon pump. Okay. For our, as a cardiac technologist, we should know, and also as a cardiac perfusion care technology student, also they have to know that. Okay. What its functions, what it goes through that. Okay, nothing but it. There is a two good things that will help our heart to make us safer. Okay, nothing but inflation and also deflation. Where inflation and deflation, nothing but systole and diastole, we can able to use the same also. Okay, where what we have to know is it is a temporary support. Okay, where we can able to assess the heart by giving a mechanical supporting device. Okay, nothing but it also contains several methods. What we have to do is we have to know a little bit of intra-aortic balloon pump and what it uses. Okay, currently the aortic balloon pump where it is used in our hospital sector was developed in 1985. Okay, and also who is the father of IABP is nothing but Dr. Adrian Cantor. Okay, and then what is the purpose of intra-aortic balloon pump? Intra-aortic balloon pump is nothing but where we can able to use while the patient have low output cardiac output, where we can able to last class we have go through the cardiac output determination, and also where we can able to assess the patient. So whenever the cardiac output is low, we can able to use this intra-aortic balloon pump to increase cardiac output. Okay, and also to increase myocardial oxygen supply, where we have to know that while the cardiac output may be a causes of decreased may be a causes of nothing but ischemia, myocardial infarction, or else something disease pathological condition that affect our heart, right? So in that sense, where we can able to assess it, nothing but myocardial oxygen gets lower there. Okay, whereas for example we'll take a myocardial ischemia where the blood flow gets stopped and also there is a necrosis formation occurs there. So there is a lack of oxygen supply there. Okay, so the myocardium requires some oxygen supply demand so that we can able to assess the intra-aortic balloon pump. Okay, and also coronary perfusion pressure, whereas coronary perfusion pressure gets lower, we can able to increase it. Okay, and also to decrease myocardial oxygen demand, nothing but if the patient maybe get a lack of we have go through it lack of myocardial oxygen demand, we require some oxygen by using this method, and also we can able to assess a peak level of oxygen demand is unnecessarily supplying to the heart, we can able to assess this by intra-aortic balloon pump. And then indication, what is what patients we can able to assess in this method. What we have to do is nothing but cardiac pulmonary bypass surgery, like that CVPG, and also the patient, those who are in support of CVPG devices, as well as the patients who are undergoing surgeries, like that the patients are able to assess this intra-aortic balloon pump for increasing the cardiac output. Okay, and also the cardiac failure patient, and also unstable angina patients. You have to know that unstable angina means. Okay, and then perioperative treatment of complications. Nothing but perioperative, those treatment which is associated and also supported before, after, and also in between the surgery, that's called perioperative treatment. Okay, due to myocardial infarction. So those members who are affected from myocardial infarction, we can able to easily assess the patient by using this IOPP. Okay, as well as it is a bridge to cardiac transplantation. Okay, nothing but if patient suffering from a, I mean, uh, what it means right coronary artery uh, gets blocked, okay, by using nothing but by kitten in the region of mm, ostium. Okay, for example, we'll take an ostium. Okay, where the patient get 40%, maybe in 60%, nothing but the places where it affected does matter. Okay, so we have to know in the ostium what happened there. Okay, nothing but if a catheter is placed there is a damping and velocization occur. Okay, there is a flow. For example, we'll take a Bernoulli's theorem. There is a flow there, A and B. What we have to do is we have to get a catheter and inserting in it. So there is a pressure increases and also the patient is suffering from lack of oxygen supply as well as blood flow. Okay, where the patient may be risk of cardiac arrest. Okay, so and also, if the patient gets RCM, LCA, LCS, and also RCA included, what we have to do is we have to doctors compulsorily suggest them to do a cardiac transplant as well as cardiac bypass surgery. Okay, and then what is the contraindications to the patient? There, this is a mechanical supporting device which can be used by or one and only placed by aortic valve and also aorta, nothing but aorta. Okay, there, if the patient get aortic diseases, okay, nothing but aortic regurgitation, aortic dissections, aortic stenting, there aortic aneurysm, okay, and septicemia, nothing but disease, I mean, bacterial conditions that occur in blood flow and also blood streams, okay, and also bleeding, diathesis, nothing but, I mean, due to lack of vitamin K, the patient bleeding gets higher, but it could not be stopped by any cause. So, what we have to do is we have to stop giving this procedure to a I mean, these are the patients that are being used for contraindication. And also peripheral vascular diseases. You know that peripheral vascular disease is what it means. So, where the patient could not be given this procedure significantly. And also, I mean, where the IUPB works, how it goes. Nothing but I have already told you, at first coronary pressure increases and myocardial oxygen supply increases. Okay, whereas while using this, you have to go through the right image. While there is a distole and also systole happening there. Okay, where we can place the intra-aortic balloon pump and also use it here. So, and then myocardial oxygen consumption gets low. Okay, what we have to do is we have a demand of oxygen supply, so the consumption gets lower, right? So, and also the cardiac gets stressed. So the cardiac load is also low. I mean gets lower, and also the cardiac output may be get lower. So for that reason, we can able to use the intra-aortic pump and also increase the cardiac output, right? So this is the intra-aortic balloon pump where we can able to easily assess the patient for your kind of okay. This is the intra-aortic balloon catheter. Nothing but there's a catheter stain where we can able to assess the previous balloon, we can able to inflate and deflate. Okay, and this is the two principal parts of working this procedure. There is nothing but there is a mobile console and also a flexible catheter with the two lumens. We can able to assess this, and the balloon sizes may be vary based patient and also the length of the patient and also the age and also the structure of the patient. Based on the patient, we can able to assess these other catheters. Okay, and also the balloon sizes that we can able to based on this patient we can able to, and then positioning of the catheter. We have to know that what is the position where I have to place it out. Okay, at the end of the balloon, we should be placed before or below 1 or 2 centimeter from the left subclavian artery, where we can able to place it in the left subclavian artery. As well as what we have to do is there is a patient with I mean 1 centimeter, I mean renal artery, where we can able to assess the patient, where we can able to go through a patient with renal artery, we can able to place it minimum 1 centimeter above from a renal artery. Okay, and also the position, how could we be able to confirm it? Okay, we can able to confirm it by using fluoroscopy as well as chest X-ray. We can able to use one and only fluoroscopy in angiographic procedures, where we can able to use a chest ray. Okay, and also, what are the triggering modes that we can able to assess in intra-aortic balloon pump consoles? That is nothing but there is a ECG representation and also ATM pressure waves and also phaser A, B and AVR. Nothing but there is a phaser here presenting which can able to assess the patient. While we are going through the third year, we can able to easily go through these all topics and also for more extent we can able to assess this. So where we can able to assess this ECG pressure, phaser B, AV and phaser A intervals, etc. Okay, where we can able to assess here the frequency, how the frequency we can able to assess how the patient may be responding to it. Okay, as well as on the inflation and also deflation, where we can able to inflate the patient and also deflate the aortic valve, we can able to easily assess. Okay, by using this we can able to get this frequency waves where we can able to assess this. What we have to do is we have to go through these all things data, we can assess this patient. So for that, I'll explain you this is a basic concept, nothing but for, and also the complications, nothing but limb ischemia. We know limb ischemia, where the limb occurs, where the ischemia occurs in the limb, that's called limb ischemia, and also bleeding from sides and intervals. Nothing but if possible, we can able to use in aorta regia and IRPP devices, where it happens is the bleeding may be occur continuously, and also blood clot may be occur, nothing but thrombosis, as well as aortic valve gets rupture by using this. If a patient get older, we can able to assess the patient, where we can assess, they can go through the patient with the rupture. Okay, after the procedure we can go through some of the patients like infections and also sepsis. And then mobility, immobility of the balloon catheter, nothing but if a patient, if a catheter is placed there, there is an immobility occur due to the malfunction of the catheter. Okay, and also compartment syndrome. Nothing but it's an, it's a muscle where there's a blocker of muscles, right? So there the swelling occur due to pressure, so it can be leads to high amount of pressure that leads to nothing but. So what are the troubleshooting that the device do? Okay, no triggering. Okay, kinking of IBB catheters. Kinking, you know what is kinking? Is nothing but stretching the catheter. Okay, and also rapid gas loss, where here in the aortic balloon pump we can able to use the helium gases, so the gas may be lost rapidly. And also intra-aortic balloon pump. Intra-aortic balloon pump, the catheter, maybe the consoles, maybe the wire connections or the circuit may be disconnected rapidly. Okay, and also the conclusion. Nothing but intra-aortic balloon pump is a mechanical device which is used to support patient in very unfavorable situations. Okay, where the patient may be get suffer from any cardiac condition, nothing but myocardial infarction, myocardial ischemia, or something else. Okay, but exclude the patient of aortic valve disease conditions and also aortic dissection and also aortic aneurysm patient, like this the aortic disease patient, we can able to conclude in it, so we can able to go further treatments. Okay, as well as this treatment is much better, much useful for the before and after of the cardiac surgery patients. Okay, thank you so much for your attention. Thank you so much.